let's go to the management strategies. Now you can see here in algorithm that we follow, and many of you who search online would be able to find that. So the first thing to be done, like in any medical problem, would be diagnosis, which means that we identify the target symptoms so that we can find the right treatment. Pharmacotherapy, or medicines as we say, there are primarily two types of medicines that are given for the treatment of schizophrenia. The antipsychotic drugs. Even though we label drugs as antidepressants, antipsychotics, anticonvulsants, I find it becoming a deterrent to treatment compliance in today's world of Google search and analysis. I like to use the terms like selective dopamine antagonists or SDAs, but that becomes a technical jargon. So while sticking to the conventional terms, I would suggest the viewers to be aware that चिड़ियाघर में सिर्फ चिड़िया नहीं रहती. In other words, the medicines under the category of antipsychotics don't just treat schizophrenia. Why am I mentioning it here is that I have had patients call me back after taking their prescription home and doing a Google search and telling me why I have given them schizophrenia medicine for anxiety. Now, because I'll be mentioning them, it is a message to people out there. These are treatment options for schizophrenia, but again can be utilized for the same purpose in other conditions as well. Coming back to the topic of management, treatment of psychotic symptoms requires bringing the balance in neurotransmitters that cause thought disturbances, namely dopamine and serotonin. Here you'll see a chart of antipsychotics. The typical antipsychotics are the older generation antipsychotics with stronger and widespread anti-dopaminergic effect, which lead to some of the notorious side effects like drowsiness, excessive salivation, stiffness in movement, and trembling, etc. Atypical antipsychotics are called newer or second generation antipsychotics, which are more selective in dopamine inhibition and also act on serotonin receptors, making them cause lesser side effects and better tolerance. These are our first-line drugs, and based on predominant symptoms, we choose the best options available that fit the patient profile like age, sex, occupation, medical conditions, etc. The other drugs that we can use are again based on the specific target symptoms. Patients may need additional medicines like mood stabilizers for agitation, antidepressants for sadness and social withdrawal, benzodiazepines for anxiety and sleep, and medicines to counteract some of the side effects as well. The non-drug interventions in schizophrenia widely known are ECT or electroconvulsive therapy. Although vilified in mainstream media, it is a good option for acute symptom management. rTMS, as explained in our previous episode on depression, is also being utilized for treatment of hallucinations in psychotic disorders. Next is psychoeducation and psychotherapy. The goal of psychotherapy is to improve understanding, acceptance, and treatment compliance. It's supportive in nature, and elements of cognitive behavior therapy are added to improve coping in these cases as well. Family therapy and caregiver support. Because schizophrenia is a chronic illness, the family needs a lot of support in understanding and dealing with patient. One important aspect of family intervention is to manage what is termed as expressed emotion, which is known to cause poor outcomes. Managing one's expectations from treatment in accordance with patient's mental state is imperative for overall stress coping and relapse prevention. Social skills training. Even with ongoing treatment, some patients may have residual social skills deficits or cognitive impairment. This is especially true for long-term untreated psychosis or with certain variants which appear early and are resistant to drug treatment. The basic SST model entails breaking down complex social repertoires like basic elements, like eye contact, speech volume, etc. And then repetitive practice helps in acquiring new skills. Support groups. With chronic ailments with widespread implications, one finds oneself isolated and lonely. Support groups help in bringing people with similar issues together to support each other in recovery. Management of comorbid conditions. The risk of depression, substance abuse, and suicide is known to be higher in patients with schizophrenia. Therefore, treatment approaches focus on identification and prevention of these issues as well. Alternative therapies. Stress management techniques like yoga, pranayam, life skills training are important aspects of holistic management and are part of broader treatment protocols. Integrative mental health. We at Manasthali are trying to integrate traditional wisdom and alternative options by collaborating with experts in Indian system of medicine like Ayurveda and homeopathy to find a holistic solution. It's a work in progress with the intention to use all available tools to help clients lead a better life. In summary, psychosis is a syndrome caused by neurochemical disturbance, causing impaired understanding of reality. It may appear in many psychiatric and non-psychiatric and metabolic conditions that cause derangement in brain activity. Schizophrenia spectrum disorders. They are specific psychotic disorders associated with a more inherent and chronic disturbance in brain functions, causing one or more psychotic symptoms like delusions, hallucinations, disorganized speech, disorganized motor behavior, and/or negative symptoms. Untreated psychosis is associated with greater disability and impaired response to treatment, whereas early diagnosis and treatment can restore normal behavior. Psychiatric medicines are the mainstay of treatment. Other psychosocial interventions like counseling and therapy help in promoting better coping, social integration, and overall health and happiness. Schizophrenic patients can lead a normal life with medicines and psychological intervention. Social support and acceptance goes a long way in management of such chronic health problems. Here, I am ending the overall discussion that we are having in these episodes on schizophrenia and psychosis, but I'm sure there are a number of questions out there. And people who want to ask these questions, they can put them in writing in the comment box and I would like to respond to them. So if you want to know more, please like, share and subscribe to our channel, Manasthali, where mind meets matter. See you next week.